When it comes to breast implants, you have a number of options now that can be combined in a number of different ways. The first is whether you have a saline-filled implant or a silicone-filled implant. A number of years ago, there was only the option of having saline-filled implants. They have been on the market for almost about the same length of time as silicone implants, but there was a period of time when silicone was taken off the market. Now both are back on the market, so women have the choice of either one. And there's pluses and minuses with both of them, but in my opinion, there's more minuses with the saline implant than there are with the silicone implant. In both implants, you have a choice of whether you want a smooth surface or a textured surface. And there's pluses and minuses for both of them, and it depends on the patient and what kind of breasts they have, how much laxity they have, what kind of activity they might be engaged in, and these are things you have to take into consideration. There's also now what we call different profiles, which is sometimes confusing to patients. Profiles refer to the width of the base or the diameter versus the height. And sometimes when we talk, there's usually low, moderate, and high. Now some companies have moderate, high, and you can get combinations. High does not refer to higher up this way. It refers to high this way. And so we have implants that have narrower bases and higher or more projection, and we have ones that are wider and flatter. And it depends on the shape of the patient's breast or chest and breast, which one and the look they want, which one they might choose. Then we also have round, most of those are all round. Then we have shaped implants, which hold they are contoured, so they're shaped more like a breast. And those come in not only different profiles, but different bases. And the bases could be wider than they are tall, or taller than they are wide, or have a round base. And then in addition to the base, it can be low, moderate, or high profile. So you can see that you can come up with 72, I can't remember how many different combinations you can put together for your options in what you're going to get in terms of a breast implant.